the panel, the discussion, an objective and impartial view of the issues of interest to you. Nation Beat is on now.
Well, hello there and welcome to the studios of the National Television Network, NTN, for this special edition of the program Nation Beat. My name is Shannon LeBon, the communications specialist with Fred Engineering, an Italian firm contracted by the state and the government of St. Lucia to design and implement what will be a socially inclusive and gender-responsive road safety public awareness campaign for the island. I will be your moderator on the discussion for the next 30 to 40 minutes. My esteemed panelists to help dissect the issues related to the topic of road safety include the project manager with the project management unit attached to the Ministry of Infrastructure to my immediate right, Mr. Amos Hippolyte, an individual no stranger to national television, the center of our panel today on the program, the Chief Medical Officer within the Ministry of Health, Dr. Sharon Belmar-George, and to Dr. Belmar-George's right, our Community Survey Specialist with the Fred Engineering team, Mrs. Anne Haywood George. She will get an opportunity to introduce herself later. And the fourth and final member on today's panelists, Senior Claims Officer at Nagico St. Lucia, Mr. Jesse Jean-Louis. Panelists, ladies, gentlemen, welcome.
Good morning. Good morning. Thank you.
Let's start with the bigger picture associated to the topic of road safety on St. Lucia, and I'll start off with Mr. Hippolyte. Your work at the Ministry of Infrastructure Project Management is normally civil works, building of roads. Why on this project did you see it important, necessary to integrate this intervention focusing on road safety?
Yeah, well, from day one, road safety was fully incorporated into this project. The people would normally see the visible roadworks, which commences from the Latok roundabout along the Millennium to the West Coast Road and to the end of the main bridge in Soufrière. This is about 49.2 kilometers of road. We recognize that there is a significant challenge. New pavement often leads to increased speeding or leads to increased speeding. The stats tells the story. This corridor serves over 13,000 motorists daily. St. Lucia has recorded over 352 road fatalities along this corridor, serious accidents along this road corridor for the period ranging from 2000 to 2016. With troubling 3-to-1 male to female road fatality. When you invest millions in infrastructure, right? When you invest millions in infrastructure, but drivers continue to exhibit dangerous behaviors, you're not maximizing your investment, right? We understand that road safety depends on user behavior, not just infrastructure quality. The road safety campaign targets specific key knowledge gaps and risky behaviors that could undermine this multi-million-dollar investment. Simply put together, better roads require better driving habits to truly deliver on the promise of safe travel.
Yeah, I think you spot on. The figures definitely speak for themselves. And CMO, when we speak often of road safety, people see it as a transport issue. But what is the real cost on our healthcare system?
So I think it's so important that when we are looking at road safety and we are looking at infrastructure when it comes to the construction of roads, the multi-sectoral approach that is being taken and the inclusion of healthcare, because within the health system, the road accidents, what we are noting, it's really a public health, it's a public health issue. So we have direct costs on health, and we also have indirect costs. When we look at the direct healthcare costs, we look at, from the emergency services, the cost of transportation through the ambulance service, our emergency room services. We look at hospital care, the emergency room costs, surgeries, hospital admissions, intensive care, the cost on the blood bank, ensuring that there's a sustainable supply of blood within our blood bank. We look at the cost of rehabilitation for physiotherapy as well, occupational therapy, long-term recovery, and maintaining medical supplies and equipment to keep up with the needs of the population when we see increases, the resources. We look at prosthetics, we look at medication, we look at wheelchairs. I also brought some of the costs of our healthcare facilities to give you an idea of what the real cost in terms of dollars compared across the health system. When we look at one of our statutory organizations, and within the public sector, the general public, they do not feel the real cost of healthcare because a lot of it is subsidized. So for example, at one of our statutory organizations where the intensive care unit cost per night would be 300 EC, but the real cost to that institution is 900 EC. So even the bill you get is a lot reduced. So the public, when they get their bill, it's not the true cost of what's happening in healthcare. Major surgery, for example, and most of those accidents require major surgery. What's the cost to the public for major surgery? $1,000. The real cost to the institution would be $4,000. Even something as physiotherapy, which we see, because a lot of those, the road accidents, you need rehabilitation later on. The cost per session, $75. The real cost per session is $900. So it's seriously subsidized. Now, the private sector, because they have a more accurate costing of services as compared to the public sector, a lot of our fees are very outdated because these are the fees for over 50 decades by legislation, and it has not changed with the real cost of those services. When you have to access care for 20 EC, sometimes just a suture for a simple laceration is 50 US. So we know that's not the true cost that the public feels. I'll just give a few of the major diagnoses relating to motor vehicular accidents to give you just a feel of what the real cost is within the private sector. For example, a broken arm from a motor vehicular accident, the cost is in excess of $22,000, the real cost of treating someone with a broken arm, because you need emergency room, you need x-rays, you need medication, sometimes the operating room. I'll just go a few of the more common ones. For example, we see head injuries, especially with the motorbikes, the motorcycles. The neurosurgeon managing someone with a head injury is in excess of $52,000 EC. And these are some of the real costs. Another example that I can throw out for you to get a feel of the real cost: hip replacement post-accident. This is in excess of $43,000.
And Doc, we haven't even costed the trauma of those incidents on your workers, on the families of the victims as well. So but from what you're saying, the resources that we're expending here to treat victims of road fatalities, victims of their own actions in most cases, can well be diverted to catering to the more critical healthcare needs of the society. And
we see, I think you're bringing up a very important cost, because with the limitations we have with our ambulances, when the fire service has to repeatedly respond to accidents, someone who may be having a heart attack, a stroke, a lot of our patients with chronic diseases at home that need immediate transfer, there are sometimes delays because they will frequently tell you they're responding to an accident or another incident. So the amount that we have to invest into providing care for those accidents, it really affects, and we see the effect it has on our bed space, because when we have elective surgery, we have beds and everything in place, even the blood bank. We always keep a certain amount of blood available for those. If on the weekend we have many road accidents and we need to utilize the blood, it means those persons who are waiting for surgical procedures, we're not able to do those procedures because the beds are taken up, the blood storage is utilized. So it impacts the entire health system, not only the patients who are involved in the accident.
Absolutely. And to help turn the curve, to help change behaviors here on the island and improve public awareness of road safety issues and the challenges, this project has taken the data-driven and scientific approach, the conduction of a knowledge, action, and practices survey. And here with George, you were pretty much at the center driving this KAP, a first for St. Lucia. What did the data reveal? What is it saying?
So first of all, the knowledge, attitudes, and practices survey that we conducted was back in November of 2024, when we would have conducted a situation analysis of road safety in St. Lucia in order to inform the campaign, which we will be implementing later on in the year. So we did this because we needed to understand what are St. Lucia's doing when it comes to road safety, what do they know when it comes to road safety, and how is it impacting them. So the data was really interesting because it revealed that even though most of the respondents, we had 384 respondents, even though 95% of them knew that there were seatbelt laws, when you look at the compliance, it's a much lower rate, right? So something is very much out of sync when it comes to the knowledge of road safety and the actual road safety practices. So these are some of the reasons why a KAP survey is so important. Also, what we learned is that 52% of the respondents blamed road crashes on external conditions. So they weren't taking personal responsibility. They were saying it's the potholes, it is bad lighting, it is other drivers, but it is not me, right? So this is really important when you're looking at these things, and it's also really important to understand that the amount of formal education that you have actually has an impact on your behavior. So we noticed that individuals who had more post-secondary and tertiary education were more likely to use their seatbelts, were less likely to use a handheld cell phone while driving. So these things make it very, very interesting because we have to make sure that the social interventions address the needs. And so when we looked at seatbelt wearing, we saw that there were low rates of seatbelt wearing when it came to drivers and self-reported behavior. Even though they know that they're supposed to wear a seatbelt, they're not wearing a seatbelt at high rates. And what was even more interesting is, as you look at front seat passengers, the seatbelt rate goes down. The seatbelt wearing rate goes down. And then when you look at rear seat, it goes down again, right? So it's really important to understand these trends, and you recognize how culture plays a role in some of these trends. So it's really important to intervene and address these trends so that you can improve the road safety situation, and that will help to reduce road fatalities, critical injuries, and take the burden off the health system so that people who actually need access to health care can do so.
I'm so happy you mentioned perhaps the cultural influence here, but what is the data saying? How frightening is it when compared to other studies that you've conducted in other regions around the world?
Yeah, so we complemented the KAP survey with observational studies. So our team leader, Paolo Perego, would have conducted some observational studies on seatbelt use and handheld cell phone use while driving. And the statistics were very frightening. I believe that 760 drivers were observed. So it's a pretty representative sample. And 11% of individuals in the rear seat, only 11% of individuals in the rear seat were wearing their seatbelts. Only 55% of drivers were observed wearing their seatbelts. that means that 45% of drivers weren't wearing their seatbelts. Now, I'm pretty sure all of us are on the panel. Hopefully, there aren't two of us who never wear their seatbelts when they're driving, right? But just to put that into perspective, and then, I mean, I look at Antigua and Barbuda, and the rates of seatbelt wearing, although they still need to be higher, still over 60%, between 60 and 75% of drivers wearing their seatbelts. So that's a much higher rate. When you look at jurisdictions like Canada or the United States, you're looking at 95% seatbelt wearing, right? But this comes because of continuous exposure to messages, extensive publication, extensive public education rather. Law enforcement has to be very aggressive. The legislation has to be in place, right? So if you don't have speeding legislation, you can't expect the police to enforce speeding. So all of these things must work in tandem in order for the road safety situation in St. Lucia to improve.
Absolutely. And Mr. Jolie, you would have heard the stats. I'm sure you see them at your desk more frequently than us. From an insurance standpoint, how do the trends of road crashes and fatalities affect us all, and in particular insurances?
Yes, so that is actually a loaded question. To answer the first part of your question in insurance lingo, and just to keep it as basic as possible for the benefit of the general public, we look at, when it comes to trends, the frequency and the intensity. When I say frequency, how often do we see road accidents? And the intensity, we look at the severity of those accidents. And I'm happy I heard the stats from Dr. George, because it supports what we're seeing. We see a lot of cases of severe accidents, which ultimately leads to high insurance payouts. You speak to how it affects drivers. Because of the high insurance payouts, ultimately, I think we all have experienced the increase in premiums. And if you look at over the past 4 to 5 years, just for a third-party policy, you see that insurance premiums have increased by $300 to $400. Yes, so as insurance holders, policy holders, we now find ourselves paying an increase of up to $300 to $400. Society on a whole, I would say that those monies, because I think we can all agree that each of our households, we have at least one vehicle. I think we all have at least one vehicle in our household. And as opposed to injecting that $300 to $400 in savings, we now find ourselves paying insurance premiums, and that's just for third-party premiums. When we look at comprehensive policies, that figure can increase to in excess of $1,000, $1,000, $2,000 for that same policy. And so I would say this is the societal impact. Ultimately, we find ourselves having to pay a lot more in insurance premiums compared to 4 to 5 years ago.
Absolutely. Thanks for sharing that. Big question now, how do we start to drive the change? We've seen the data, we know the effects. Mr. Hippolyte, where do we start driving the change nationally?
Well, let me thank you for this question. While we knew that speeding, alcohol, the use of alcohol, phone cell use while driving were major crash contributors, we needed hard data to design effective interventions. And that is where our CAP study, which our panelists speak earlier on, which provide the evidence-based, right? So the campaign will targets the high-risk groups, such as young men, age 18 to 35, vulnerable vulnerable groups of road users like pedestrians and motorcyclists, and disabled or people with disabilities which have unique road safety needs, right? The value of the campaign to communities will be both immediate
and long term,
right, and long term, right? Our project corridor includes 9 schools, serving over 3,000 students, particularly vulnerable. They are particularly vulnerable road users. The campaign will seek to launch a robust program or education program in schools along the project site, and partnering with community organizations, the teachers union, teachers,
parent-teachers
associations, and other disability advocacy groups, right? So when communities practice safety, road safety, this helps to safeguard the multi-million-dollar investment, right, while creating behavioral changes, right? This ensures our infrastructure improvements deliver real benefits for families and individuals, not just better roads, but safer journey home.
I want to in just a bit engage Mrs. Haywood George on the educational components of this campaign, but before Ms. George, Dr. Belmar George, let me bring you back in on the discussion again. How can campaigns like this one reduce that stress and that burden that you spoke of on the healthcare sector?
Well, campaigns like this one is very important, and I like the thrust that the campaign is taking, ensuring that it's multifaceted, because we have many different stakeholders and sectors that need to play a very active role. One of the important ways is in raising awareness about the risks that exist, educating the public on speeding, on drunk and drugged driving as well, because our Substance Abuse Secretariat has noted it's not only alcohol, it's a lot of the smoking and all of the other drugs as well. Also, the importance of wearing seatbelts or helmets and the importance of sleep deprivation and fatigue. We also see that as another cause contributing to road accidents. It also helps to change risky behavior as well, to encourage defensive driving, to ensure the proper use of the pedestrian crossing and traffic signals, to reduce aggressive driving as well, and also respecting other road users. We're also, to me, a campaign such as this would also improve the compliance with the traffic laws, because we know in St. Lucia, we don't see a lot of people compliantly. People park anywhere, they speed against the limit, even in school zones, and like her data suggested, the seatbelt use is also low. And also promoting the use of the safety equipment. A lot of our, especially the motorcycle drivers, they don't utilize the helmets, and we see that contributing to the extent of the brain and head trauma that we get within the emergency room, and also the child safety seats as well. The other issue, which I think we see especially in the minibuses, is the regular servicing, like who's monitoring the public transportation vehicles are being serviced regularly. We see a lot of those vehicles, they normally say the brakes, there's an issue with the brakes, but if they were serviced, especially since they're on the road a lot more than regular vehicles, the regular servicing and maintenance. And I also heard about the targeting of the high-risk groups. And these are the youth, the commercial drivers, and also the motorcyclists. And I think looking at the roots of the problem is where we need to go, because the data from the epidemiology unit clearly showed that over 88% of the total deaths within the period for 2018 to 2023 were male. And with the exception of 2019, the males between 25 to 44 are the age groups that are most impacted. We also see 15 to 24. So this is the young males that are impacted. And our data continue to show that they are the ones making up. And when you look at the risky behavior that's involved, it's really coming to the risk of why. And addressing not after the fact, but looking at the social determinants, the social issues that's leading. And this is how the preventative measures is always the most cost-effective ways of addressing the issues. So I think this campaign, being multifaceted, looking at all of the issues from the level of the community, the social aspects, the preventative measures, if we are to get a very effective campaign coming out.
Yeah. Doc, if you permit, I want to zoom in just for a minute on driving that change. And in your remarks just a while ago, you said that our people are non-compliant to a lot of the laws. So if we have to drive that change, do you agree, or do you see the need for the legislation? Because you spoke to drunk and drug driving. The legislation to enforce and to ensure that we drive that change, non-existent.
Right. So to get the change, we have to look at all of the levels. From a societal level, looking at the families, the upbringing of our young males, because it's not only showing up in their driving, it's showing up in other levels, a level of defiance, a level of disobedience to laws. But we also need, on a policy level, that we get the level of supervision, enforcement by the police. Within our ER, a lot of times with those accidents, the physicians would say, we think he's drunk, we think he's high. We need to have regulations where within short time we are able to take blood samples, urine samples, to be able to test. And this data would be really important to show why we are seeing so many young males driving way past the speed limit. We are seeing so many accidents. It will give us information. And unfortunately, in some societies, you need a level of regulation and enforcement to get people to do what they need to do. So it's definitely important that we have proper laws, we have enforcement of those laws as well, if we are to be effective in getting the change that we want to see.
Absolutely. Thank you, Dr. Sharon Belmont-George. And I want to bring you back in on the discussion here. Campaign is described as a socially inclusive and gender responsive campaign. For the ordinary man and woman, what does this mean, and how is it shaping your approach?
Yeah, so when you talk about being gender responsive, you're looking at the road design, you're looking at infrastructure, and you're looking at policies and how they affect men and women, people with disabilities, and children differently. So things like masculinity, perceptions of femininity actually affect road user behavior. So for instance, if there is socialization taking place that is telling males that it is attractive for you to speed, you're showing your masculinity, you're showing your strength by speeding, and this is happening in the demographic that is disproportionately represented as road crash victims, and that is 18 to 35. And this is why we're tailoring the campaign with the primary group being males 18 to 35, both drivers and passengers. Then you really need to address that, because men and women and people with disabilities, we use the road differently. So for instance, you may notice that more women use public transportation, more women are traveling with children, right? These are things that we have to think about, because accessibility with respect to the roads has to be equitable, right? So you want to make the road infrastructure inclusive at all levels, and this is why you need to be collecting data on road crash victims and disaggregate it by sex to see, oh my goodness, most of these victims are males 18 to 35, so we have to include an intervention. We have to address the needs specifically of that group because they are dying at such high levels. And then you look at pedestrians who are at risk and you say, we also have to ensure that there are interventions that are helping to improve the situation of pedestrians, right? But The gendering is very, very important because a lot of these social norms, these behaviors are gendered. And again, going back to the KAP survey, we noticed that more males tended to think that speeding was okay. So they were reporting higher levels of speeding. They were reporting they were reporting lower levels of seatbelt use. So we saw that more females were likely to engage in seatbelt use than males, right? So it's demonstrating that road user behavior is gendered. So it's something that we can't ignore. And by inclusivity, it means we're adopting a multi-sectoral approach. So you're seeing people with disabilities, the police, the Ministry of Education, the Ministry of Health, all partnering so that we can approach road safety in a way that is going to transform the nation and get people to understand that it needs to be prioritized.
Very informative and important discussion on the National Television Network, focusing on the issue of road safety. When we come back, we'll continue with Mrs. Annie Haywood-George, the Chief Medical Officer. Dr. Sharon Belmar-George is also here with us, Mr. Jesse Jean-Louis from Nagico St. Lucia, and the project manager, Mr. Amos Hippolyte. The discussion continues momentarily.
Suicidal thoughts, like other mental health challenges, can affect anyone. It can be you, your colleague, family member, or neighbor. Everyone has a role to play in preventing suicide. Know the warning signs. If you or someone you know is in crisis or emotional distress, call the suicide hotline at 203. Remember, help is available. This is a message from the Employee Assistance Program, Department of the Public Service. Contact us at 468-2269 or 468-2260.
Hello, OECS.
Yo, OECS, this is your ocean. If I am to protect your future, we have to work together. It's the time to work together. If I am to help protect your future. Once I used to be so pure and clean, and those hills were so fresh and green. But now you see me as your dumping ground. The current situations has me choking on your pollution. Think hard about it. You will agree that really there is no you without me. Make the zero waste pledge, be responsible. Reduce your waste, recycle where possible. Yeah, it's down to you, so make the commitment. Recycle for blue oceans and our betterment. Recycle OECS, green actions, blue oceans. For blue oceans and our betterment.
Welcome back. Our discussion today under the theme Driving Change, Road Safety as a Public and Social Investment. We told you earlier that we're taking a diverse approach to this troubling issue on St. Lucia, and we have partnered with numerous stakeholders. That partnership critical for us to really turn the curve and see an improvement in the road safety situation. A key player in the discussion joins us now on the panel. Inspector Calixtus Shalman from the Department of Road Safety and Traffic Investigation. Welcome, sir.
Welcome.
Your role as the police, critical if we really have to drive change and change the behavior. Speak to the role of enforcement and the duty of the police.
With road safety, enforcement is critical, and there's a perception that without enforcement, the road cannot be safe. We're one of the strong pillars for road safety, and the absence of enforcement, you find that the road will not be safe for all. The police force, we have a challenge which comes to road safety, certain laws that have to be enacted so that the road can be managed when it comes to enforcement is lacking, and there's a drive for that to happen, especially when it comes to distracted driving, jaywalking, and the trouble one, which is speeding. And not to mention driving whilst intoxicated.
Yeah, I was going to go there because CMO gave us some frightening statistics just before you joined the panel. But you are agreeing, for you to enforce, you need the resources first of all, and you need that legislative framework.
As we speak, we have the human resource, and what we need is the training, and then we need the equipment to support us in regards to some of the enforcement.
To drive that change, where do we begin to lobby for the police to get that additional support?
I think that the nation, the citizenry should start maybe within their organization, start to foster that togetherness in order to highlight the issues that affects the citizenry, and then maybe the main stakeholders will recognize the need to start spearheading it. And the traffic department, we are in presence, we have increased the presence on the road, but we need more than presence on the road.
And you have that will internally?
Yes, we do. We do.
Mrs. Haywood George, let me come back to you again to speak to the important interventions that you will undertake within the education system to start to drive that change, especially with the next generation of drivers.
Yes, so one component of the campaign is outreach education activities. So we're focusing on 4 project area schools. So all of those 4 schools are located within the project area that the Millennium Highway and West Coast project is in. So we are going to be engaging in various activities with Soufriel Primary and Secondary School, along with Ciceron Combined and Ciceron Secondary Primary School. We're going to get teachers to deliver lessons on pedestrian safety to some of the primary school students. We're hoping to have a mural or art or video competition with some of the Form 5 students. We're even looking at possibly a road safety talent show. We also want to do a road safety march, have the schools in the project area mobilizing around road safety. We would need the support of the police to maybe block off a road, and you have these students with their placards and the campaign slogans rallying and saying we need to be safe, because so many of them don't have the proper infrastructure to protect them when they are walking to school, right? So we really want to make it very interactive when it comes to reaching out to the schools. And we know that road safety education starts with young. So you have to be socialized from the onset to wear a seatbelt. So you need to grow up in a child restraint first, and then in the back seat, you have your seatbelt on, move to the front seat, you're wearing your seatbelt automatically, and by the time you're driving, you don't even think about it, right? Yeah. This is what we want. So we're partnering with the schools, we're partnering with the 4 principals in the project areas to really create a robust outreach initiative. And because we have road safety champion Julian Alfred on board, and she is of course an Olympic gold medalist, a treasurer of St. Lucia, track sensation, and she happened to attend Ciceron Combined. So we want to get her involved in some of these activities because we know that she can impact that targeted demographic. Right? Because the secondary target group is females between the ages of 18 to 35 who are passengers and drivers. And of course, the males between the ages of 18 to 35 have to be able to relate to the campaign. So we also have Ricky T on board as a road safety champion. And we're hoping as well that he can be involved in some of the outreach education activities if that is possible. So we're really excited about that. And this is one of our primary focuses on campaign implementation.
I saw Mr. Jean-Louis nodding in approval, like yes. Nagic also in Lucia will definitely be excited in supporting some of these activities. What say you to drivers who think the issue of road safety is not theirs but somebody else's business?
Well, what I would say is that ultimately insurers are having to foot the bills and the cost of all what we have mentioned so far. And so what you find is that we have to not only look at the road users should May I give you another round? React to the question. Yeah.
We're just asking you your message to drivers who think it's not their personal responsibility, but it's the responsibility of someone else.
Yes. Well, we must all take our responsibility as road users. Ultimately, it falls on us as, first and foremost, we have a responsibility to ourselves and to others. Again, we must also understand the financial impact that it has on the wider industry, as I'm speaking to insurance, as it affects all of us financially, because as insurers have to pay off these sort of costs, we look at, Dr. Belma mentioned one of the aspects of injuries, and broken arms, for example. That is one facet of a insurance settlement, right? Some of the other facets, we have to pay the cost of the damaged vehicles, both to our insured and to the third party. Outside of just the damages to the vehicles, there might be damages to public property. So you may have, perhaps a vehicle may collide into a wall subsequent to the collision between the two vehicles. We have to foot that bill. When you look at other facets of your general insurance claim, you have the pain and suffering. This is another part of a claim settlement that the public perhaps may not even think of, and that is the portion of most claim settlements you'd find that takes up the brunt of the settlement. So you may pay a vehicle, let's say, in the amount of 20,000, but perhaps be pain and suffering depending on the injury in excess of 100,000, and that is very common.
Devil's advocate for 30 seconds.
Yes.
If we don't drive that change now, 5, 10, 15 years down the line, the model of insurance business here in St. Lucia is going to change, you think?
It will definitely change. It will definitely change. Persons may find that it may become more difficult to acquire insurance, which is already an issue some people are facing, because insurance companies are trying to protect themselves. And it's not because that it's a case where we don't want to insure people, but it's a case where if we are to remain solvent, if we are to remain above ground, if we are to be able to pay the claims of, let's say, responsible road users, these are measures that we'll have to take, because ultimately, if the trend continues in the way that we see, insurers may very well not be able to have business on island in St. Lucia locally. And I could speak locally because, again, we can see internally the statistics. So we must do what we have to do on our end to be able to pay claims, because ultimately that is the role of insurance, to pay claims. And so we must protect our interests together with our insured's interests.
Frightening reality. Not much time left for signal to our producers that there's definitely a need for part 2 when time permits here on the National Television Network. But to wind down, I want to give our esteemed panelists each 90 seconds to share a message to the St. Lucian public, particularly as it relates to personal responsibility on the issue of road safety. We start, of course, with Inspector Charlemagne.
I want to emphasize the point that drivers, pedestrians, passengers, you owe each other that care, that duty of care. And you have to take personal responsibility for your safety. And also persons that are in your care, you must ensure that their safety is well taken care of. And then for those who have the responsibility of ensuring that person's safety is maintained, like law enforcement for us, that we do what we're supposed to and we must in order to safeguard our citizenry. And with the police, we're doing our utmost so that our road users can be and will always be safe on the road network.
Thank you, Inspector. Dr. Charlemagne George.
Thank you so much. Road safety and traffic accidents has become a public health issue. It greatly affects our hospitals and our healthcare workers. The costs are much more than the cost to provide care, but long-standing, both economically, socially, and the impact on the family and our communities. So I really want to let the public know that we need to take personal responsibility, both for our health, for our family, and those that we are transporting, and other road users, because it's affecting the entire community and country as a whole.
And thanks for coming, particularly to share the data with us to help drive that change. Mrs. Anne Haywood-George.
I think it's really important for residents and citizens in St. Lucia to take action both collectively and individually and ensure that you practice road safety every day to protect yourself and to protect others. And I'd also like to take the opportunity to applaud the people of St. Lucia for the very high level of stakeholder engagement with respect to supporting this campaign. We just had a very successful 2-day workshop series with civil society, public sector, youth stakeholders, private sector stakeholders. So I just want to applaud them for their efforts, and I look forward to continuing to engage in interventions that will help to improve road safety in St. Lucia.
Mr. Jean-Louis, today you have the final word.
Yes, again, I just want to reiterate that we all have a responsibility not only to ourselves but to those around us. So we have the duty as road users to do what is necessary in order to curb what we're seeing right now in terms of the trends of road accidents, and ultimately just what we want as a whole is to see an improvement. Yes, so it's just to encourage all of us to be responsible on the road and do what we ought to do as road users.
Thank you, ladies and gentlemen, for joining the panel. Let me also thank the project manager, Mr. Amos Hippolyte, who was on the panel a little earlier, sharing important information, important data on why we must tune the curve as a society. We are losing our young men, and we are affecting the future of this nation if we do not start to change our behaviors right now with respect to road safety. On behalf of Fred Engineering, the international road safety specialist firm, my name is Shannon LeBon, thanking you for watching. We'll see you again next time.